Let's move on to other news today. And in Saudi Arabia, they've got domestic matters also on their hands to look at, as health officials say they're doing all they can to avoid an outbreak of the deadly Middle East respiratory syndrome, or MERS virus, at this year's Hajj pilgrimage. It is a mystery virus with no known cure, and it was first detected in Saudi Arabia in 2012. Well, since then, more than 850 cases of infection have been confirmed, and more than 300 people have died. Well, cases have also been confirmed now in Jordan, Qatar and the UAE, as well as in parts of Africa, Europe and the United States, usually after travel to the Middle East. The exact source of infection isn't known, but it can cause kidney failure and pneumonia. Saudi officials have been accused of not doing enough to contain the outbreak, but the country's acting health minister has told the BBC that the situation is now under control. Well, the BBC's global health correspondent Juliet Mazumdar is with me now. You've just returned from Saudi Arabia, and what about this allegation that they really have not done enough to contain it?
Yes, well, this has been an allegation that's been ongoing really for the last year or so. What we saw was that this virus emerged in Saudi Arabia, as you say, at the end of 2012. There were sporadic cases since then, but what happened in the spring of this year, there was a huge spike in cases, several hundred new cases, and it was only then that Saudi officials decided, right, we're going to get a grip on this. And since then, they have been introducing new measures to ensure that that happens, particularly on the run-up to Hajj, when around 2 million people will descend on Mecca and Medina in the next few weeks. So they have set up
crucially, Muslims come from all over the world and then return. So this is how virus spreads very quickly.
Exactly. They'll all be together. They'll all be very close together in very confined spaces, and they will then go off to their respective countries. But we were given very rare access to the kingdom to see what officials are doing to deal with this ahead of Hajj.
Is this the key source of the deadly MERS virus? Camels are prime suspects for passing the disease to humans, which is why health officials are taking samples from these prized animals.
There's believed to be a strong link between camels and the virus, but still very little is known about how it jumps from animals to humans, and that is worrying scientists.
The virus is fairly harmless in the animals, but in humans it can cause pneumonia and kidney failure, killing more than a third of those infected. But the real problem began when patients ended up here. Poor infection control measures in hospitals like this one, where I was shown around, meant when a MERS patient arrived, the virus spread fast. Doctors here admit staff weren't washing their hands between patients or wearing masks properly, which means they were helping pass it on. It wasn't until a year and a half into the outbreak, when the king sacked his health minister over his handling of the crisis, that things started to change.
So now we are going to start.
Now hundreds of hospital staff are trained in infection control, and the number of MERS patients have fallen dramatically, from hundreds back in the spring to very sporadic cases now.
Your first exercise, take normal breath, deep breathing, for 1 minute.
But still, relatively little is known about MERS. The government has advised people to wear protective gear when handling camels, especially if they're sick. But at this market on the outskirts of Jeddah, we didn't see anyone taking much notice. Raw camel milk, which could contain the virus, was being sold and drunk freely.
I don't know about this virus. It didn't come here. I have drunk raw camel milk every day for the last 17 years, and I am fine.
At these high biosecurity labs, scientists are trying to figure out where this virus came from, particularly on the run-up to Hajj, when around 2 million people will descend on Mecca.
Being a virus that is transmissible from human to human really is a big concern for Hajj, because you know that we have intensive overcrowdedness in Hajj, and this is an excellent media for a respiratory infection to spread.
But the government is reassuring pilgrims.
MERS is not anymore an issue in Saudi. We will do our best to ensure that we continue doing all what we can do to have a safe Hajj to all our guests, pilgrims.
The outbreak may be under control for now, but the World Health Organization says the situation continues to be a public health concern.
So, Tulip, really interesting report there. For anyone who is planning a trip now to Saudi ahead of the Hajj next month, what should they be doing?
Well, the advice is to do see your doctor or travel advisor before you head out, particularly if you have underlying health problems. Most of the people who have died from MERS actually had another chronic issue, diabetes, that kind of thing.
Because they're susceptible.
Exactly, it makes you more susceptible. You know, just be aware. I mean, during Hajj, there's something called the Hajj cough, because people do get sick when they're all together. But just, you know, be aware of yourself, be aware of others. If you are sneezing or coughing, you know, they have given a specific way to do it. You know, sneeze into your elbow rather than into your hands. If you see other people doing that, you know, keep your distance. We've got the camel issue there as well that we saw. The World Health Organization says if you do want to eat camel meat, it's very popular in Saudi Arabia, or drink camel milk, make sure the milk is pasteurized, make sure the meat is cooked thoroughly. And if you do get sick, then to try and get medical attention as soon as possible. And the Saudis are well prepared for that. They're used to many people coming in at this time, clearly, and they have surveillance systems in place to pick that up. But if you do get sick, do get help urgently.
Tulip, thanks very much. Really, really interesting to talk to you. Thanks.